Number one question I ask every single dentist, how bad is fluoride?
That's a very debatable question. The answer is...
Who do you think's got the best smile in Hollywood?
Best natural smile, I think Angelina Jolie. Oral health is closely linked to overall health. People with chronic gum disease have developed over years of neglect and poor hygiene are linked to many other diseases in the body.
What top 3 supplements do you recommend people take to get really strong teeth and bones?
That only matters at a really young age when teeth are developing. But once you're older, once those teeth are developed, that doesn't matter.
I know you specialize in veneers. It's become like a big thing right now
Yes.
in LA. Like chicks have Birkin bags,
And
guys
veneers.
used to have Rolexes, but now it's like you gotta get Botox and get veneers
Yeah.
to flex. Dr. Dan, dentist. You know my question. Number one question I ask every single dentist. How bad is fluoride?
That's a very debatable question.
It is, because I've asked longevity experts, I've asked dentists, I've asked non-dentists, and I get 2 different answers. I want to hear your answer.
The answer is everything within moderation, like in small doses. Fluoride has been proven to strengthen enamel, of course, prevent cavities, but in very micro doses. That's why it's put in toothpaste. It's not supposed to be ingested, swallowed, eaten, drank, whatever. But obviously, on the other hand, fluoride is known to be a toxin and cause problems if it's in higher doses or ingested.
But microdosing at what?
Not microdosing, in micro doses.
In micro
In
doses.
micro doses.
So what happens?
Which means
But you're microdosing.
brush your teeth and spit it out, pretty much.
But you're still going to swallow some.
And it's going to get absorbed.
And that's why it's micro. But that gets
But you're
dissolved. That gets dissolved.
but what if you brush your teeth 3 times a day?
Excellent. That's good for your teeth. But then it's not predictable if fluoride really has a permanent or long-term effect on your body in those doses.
What are the effects, though, if you accidentally, swallow it a few times?
Nothing on paper.
I heard it lowers your IQ.
Nothing.
Have you heard that too?
I heard that and I read that, and it's not we like the evidence-based information.
Me too.
There's really no studies that can really pinpoint and link this to that. It just doesn't.
Okay,
So-
what about chlorhexidine?
Excellent for the gums. It's antibiotic.
What's that? Is that in that other toothpaste?
It's that
the
shit
rinse.
that fucking Dr. Other dude that comes to the house puts in the bottle.
Oh, yeah, I like that too.
Yes,
Is
so
that good?
It's good. It's antibiotic for
The gums.
gum bacteria. Correct, and it kills the bacteria. You're not supposed to be swallowing. That's an antibiotic. So it's not a toxin.
What's the toothpaste the other guy was telling us to use?
Boca.
Boca. Do you like Boca?
Boca's a non-fluoride, very natural toothpaste.
But it has this other ingredient in there that's supposed to build enamel.
Yeah, hydroxyapatite.
Yeah,
Correct.
that
So
one.
that's the newer non-toxic version, and that obviously supports. I'll just tell you from personal experience, having patients. I had a patient that I haven't seen maybe in a year or so, over a year, who had switched to a non-fluoride toothpaste.
I did the same thing 3 months ago.
Non-fluoride toothpaste.
Yeah.
They weren't the greatest flosser, but I think the toothpaste contributed to what happened. So she came back about a year later, update her X-rays, update her records, and there is beginning of cavities in a good amount of teeth in there.
Yeah, I need to
In
go back to
between a lot of these
fluoride.
teeth.
I need to go back to fluoride, dude.
That's just really from a live example of a patient that's not a high risk for cavities. She doesn't have a high sugar diet or anything that would contribute to cavities as much as anybody else, but
It's not as good as fluoride.
She cut the fluoride toothpaste out, and it kind of, and that's
Okay,
not
how
just
do we-
one patient. It's
I
more
think
than
we
one
go
patient.
every other day. So one
Fuck
day
off, once-
fluoride,
once a
one
week,
day
bitch.
the other one.
No, once a week.
And listen, toothbrushing is technique sensitive. It's
I
a
use that
technique.
Oral B, not the Oral B, the other one, Sonicare.
Yeah, correct.
So $300 one.
brushing and flossing, of course. You floss,
Yeah.
you brush.
Okay,
even
how
if
do you
don't
feel
use anything.
about those portable flosser things?
Yeah, those are great. Just like I said, technique sensitive. So if you're using them the right way, you're cleaning in between your teeth. I use them. They're great. I don't have cavities, thank God. So it's just how you do it, not what you use.
Let me ask you another question. I know you specialize in veneers, and it's become like a big thing right now in LA. Like chicks have Birkin bags,
And
guys
veneers.
used to have Rolexes, but now it's like you got to get Botox and get veneers to flex. Are you seeing a lot of that? Like guys coming in
Yes.
to like get veneers as a flex that they got money?
Yes, and especially in LA, they really like that bleach white look.
Like the cheeklets, like they got the bubble gum.
Yeah. So and there's different quality of veneers. There's veneers that are chiclet piano keys done
Yeah.
elsewhere, and there's like good quality veneers that are done in that shade, but very natural shape, natural looking, in a way where they look like your teeth, but better.
But they're not shaving the teeth down like T-Rex teeth anymore before they put the
We
veneers?
try to be as conservative as possible.
Define conservative.
Minimal shaving, as much as necessary to have a healthy veneer on top of your tooth without removing too much tooth structure. And obviously you don't want thick and bulk either. So you got to make space for that veneer to be slapped on the tooth and still feel natural, look natural, and be healthy for the gums too.
Does it change your speech when you put veneers in?
Not if they're done well. Absolutely not.
Because
They
some
should.
people have like a lisp when they talk, and you can tell it's the veneers getting in the way of the
They
tongue.
could be too thick, too long, whatever. But they have to be done right, obviously, and studied properly.
Are they more stable these days? Like they don't pop off as easy?
Correct. So the technology's gotten better, the materials are better, the bonding's better, and the technique.
Well, since you're
is
not
better.
shaving as much, there's more to stick.
More enamel, and enamel is the best thing to bond to, and the bite has a big, play in if they pop off. If your bite's too heavy or your grinder, you stress the teeth and the veneers a lot, more likely to break something or pop it off.
Do you have to worry about a cavity in between the veneer and the tooth?
That's a good question.
Yeah, that's a great question because patients ask, like, do I still have to floss? Do I still have to brush? Of course you do. So your veneer is a layer on top of the tooth. That margin, that connection between the tooth and the veneer should be cleaned like any other tooth surface. And that's where a cavity could start if it's not brushed, just like your natural.
But I'm saying like center line of a tooth.
No. It starts creeping in from the edges if it's not.
Okay, but it won't go
maintained.
from the inside.
Correct. It has to be exposed to sugars and bacteria and things from outside.
Dude, every dentist I know was a dentist. And like 10 years ago, they were all dentists where it was like, we just do cleaning, we do this, we do that. Now everyone's like, oh, we do veneers. I'm like, what's going on in the market? Why is it shifting into like, everyone's doing veneers?
And Invisalign.
Yes.
Like
Yeah.
before you used to have to go to the orthodontist.
Or you were 8 and you got Invisalign. Now like adults are getting Invisalign, they're getting veneers. What's going on?
I think obviously that it's more exposed now. You see a lot of that on social media. You see people in front of the camera now significantly more than they were before, and so their appearance matters, and that's a big signature. There's their smile, their speech, to be confident, talking, smiling.
You know what I heard?
And it's a trend. It becomes a trend.
I heard the way you can tell someone's beauty is by the number of teeth that show in a smile. So like I've seen women that have a smile and you count, I think it's like 8 teeth. It's like 6 or more teeth show in a smile. It just shows how pretty a girl is. So if you take a look at pictures of girls smiling, the more teeth they show in the upper, the prettier they are. If you look at Margot Robbie, for example, I think she shows like all of her teeth when she smiles.
Cameron Diaz,
Yeah.
Angelina Jolie,
So
these icons.
I have never fucking heard
It
this
is.
before.
I'm
You've
telling
never.
you know that, right?
Have you noticed that?
No.
Have you noticed the smile? Beautiful, bright, wide smile.
Yeah.
Kind of like it's caught your eye more than like a small smile with a couple of teeth showing. Well, that's kind of what we aim to do when we are doing a smile makeover, to build the smile out, to show more teeth and fill your smile with nice white teeth rather than shadows and gaps and just a couple of teeth showing.
Because I know your background's architecture, and I know with like Denzel Washington in Hollywood is known to have the perfect symmetry of his face. It's supposed to be like 1/3, 1/3, and 1/3 to your hairline to have like the perfect symmetry in your face and everything like lining up.
How much useless data do you take in?
Bro, don't you study beauty?
It's not.
No!
This is how you can tell if someone's pretty based on their symmetry. How does that work with teeth?
He's hit it spot on. That's exactly it. So beauty and symmetry have this tight correlation, right? So the more symmetrical your face, your right and left halves, and the more symmetrical your face, obviously with the height, the thirds, is linked to an increased perception of beauty. And when we're doing smile design, that's kind of the same thing. It's building out the smile to a proportional manner that fills your smile in this lower third of your face with more teeth that show, of course. And so, like architecture, like we're saying, we're trying to build it out and achieve that full smile look that patients would come and bring me a photo of a celebrity and be like, I want to look like this. That's what they're really looking for, to show more teeth and to have this beautiful full smile of teeth.
Because I know with plastic surgeons, they go in for like a nose job, but it's
Yeah.
like it's not a nose job. It's nose plus the chin plus like other areas to fill and balance
Facial
everything out.
balancing.
It's facial balancing has become like the newest thing.
And
People need to
dentistry is-
delete social media.
No, no, it's an art form, man. I'm telling
How
you.
It
the
is.
fuck are people affording this?
That's another question. How are they paying? How much does it cost to do veneers?
It could.
Let's say 12 top and bottom.
Because you could go to Mexico
Yeah.
and get it done, but then you're coming back like
Chicles.
because they're not paying attention to the things, right?
Correct.
To the like the
Exactly.
dimensions,
the details,
yeah.
and the quality of material, and obviously longevity of what you're paying for. 20 units, let's say 10 upper, 10 lower, will run anywhere between $25,000 to $45,000, depending on what's involved and what's needed, and kind of also qualities of material.
But how long does it last? Like, how often do you have to change them, update them? I don't know. Like,
Well, in the past, they would give a 10 to 15 year lifespan. It's not like there's an expiry date on your veneers, but in about 10 to 15 years of service, constantly chewing, functioning, brushing, aging, they're due for replacement. But these days, I've seen veneers that are 20 plus years old, well maintained, in great shape, minor problems like a little chip on the edge or a little bit of recession of the gum. You wouldn't change the full set at that time if it's just a very minor cosmetic issue. So today you're finding that they're lasting longer as long as they're more conservative, they're bonding better. They could last you 25 years. They really could. They could. It's a good investment. You're paying this much up front, but it's lasting you 20 years of service.
But how are people affording this?
Now, and medicine in general, everything medicine, there's payment plans, just like we buy a car. And
Is
you
that a
don't have-
majority of people doing it that way these days?
It's mixed.
Oh.
It's mixed. People would save up for it. People would get on a payment plan and just
Yeah.
make it part of their life.
I got an interesting question.
Yeah.
Have you found anyone able to use it as a tax write-off? Say I need it for business, and like my smile is my business. Like use it for a tax write-off.
Maybe for an agent.
I'm sure they're able to. I don't think.
Have you heard?
I haven't had anyone share that with me.
Be like,
I'm
my
sure if
company's gonna pay for my teeth.
If they're a YouTuber or a social media person or anybody that's in front of the camera, they could easily say, "Of course, it's an investment for my appearance."
You think so?
Just like your clothes
Depends
or
on
your uniform.
who's doing
or
our
something.
taxes that month or that year.
Probably.
That's crazy. What's the wildest case you've ever gotten?
I have some photos on my phone, of course, in my history.
Well, like a crazy story at the office. It doesn't have to be like work related. It can just be like a hilarious situation
Or shitty situation.
or the expectation.
There's a lot. Like I said, sometimes they'll bring me a photo of a celebrity, and they want to look like the celebrity, and I'm like,
But just from the teeth.
I'm not a plastic surgeon.
Yeah.
And I don't know how to break it to them. Like, you need more than teeth to look like this.
Mm-hmm.
But,
Who's the number one picture that everyone wants that they bring to you?
Kris Jenner.
The face or the teeth?
They bring me
You
the
saw
whole
her.
photo.
You saw her like transformation, Kris Jenner's transformation.
Yes.
She like went back 40 years. Did you
Yes.
see that?
With the
I heard that
plastic.
doctor was like $500,000 too for that facelift.
Correct.
Bro, that was a Monday fucking income for her.
I know. But I'm just
That's
saying.
true, but yes,
Yeah.
it was up there. It was about $250,000 or something like that.
So Kris Jenner's like the teeth that everyone wants.
Kris Jenner, that smile, it's a full, bright, wide smile, just like we were talking about. And
I would think
that's
Margot
one
Robbie.
that I've gotten more than one patient bring in or tell me, this smile, like they want that smile.
Who do you think's got the best smile in Hollywood?
In Hollywood, the best natural smile, I think Angelina Jolie has
Okay.
the best natural smile. Best smile makeover.
Yeah.
There's a lot out there. Some of them are so good that they look supernatural. You can't even tell if they were done. But I don't know. I don't have a name at the top of my head.
Do you prefer the style of natural that you can't tell they're done, or do you like the ultra fake look?
I appreciate the Hollywood smile. I do. I like
You're
it.
spending $40,000. You want the whole world to know it.
I like doing them. I do them to a point where they look and feel natural, but they're just white.
Just that extra that it's
Exactly.
like it was paid for.
They're bleached. And patients have told me exactly what you said. I'm paying this much. Might as well get them as white as possible.
Do you ever get any sugar babies coming in
Yeah,
and
oh,
saying,
yeah.
like,
Oh, yeah.
my financier is paying for my
I've-
teeth? Dude, you work in Beverly Hills. I'm sure you
I've had a gentleman, very great guy, who brought me multiple sugar babies.
Really?
And yeah, over a few months period.
Does he
And
get a
I've done their
discount card?
teeth. He sure does.
When he goes in,
He
do they say
stamps
welcome
that,
back?
and then he gets a free one after the 10th one.
And your staff is like, oh, new patient?
Yes.
They never admit.
No,
Okay.
nobody shared.
Very
It's all
discreet.
private and confidential. But
That's
yes,
funny.
I've gotten that multiple times.
What's the age difference
And,
between the gentleman and the...
The sugar baby in the early 20s and gentlemen probably late 50s in that range.
Interesting.
Yeah, and there's more than you think out there.
What
for
about the
sure.
opposite? Any sugar mamas bringing in their young...
No, I don't think I've had that.
You haven't
I've
seen-
had patients in the cash industry, the nightlife.
Nightlife or the...
nightlife
or
cash
that green
industry,
life?
and they bring in some stacks of singles and lots of stacks of cash, and they want their teeth done, their smile done. Yeah, they're all fair patients, so.
Interesting.
Yeah.
So Beverly Hills has got, like, I'm
Beverly
sure...
Hills.
Well, you have 3 locations. Which one's the most fun?
Where are the
Bev-
locations, first of all?
Beverly Hills, Northridge, Thousand Oaks.
I can tell you Northridge is probably, I have a cavity, fix my cavity.
Yeah.
Right?
Or implants, surgical stuff, failing teeth, gum
Okay,
disease,
normal
things like that.
dental stuff.
General dentistry. Thousand Oaks, you got a different type of crowd there. Usually towards the retirement
Oh, so
age.
it's like dentures.
No, not necessarily, but maintenance. That's where they do full mouth rehabilitation. So this is like at the later age, in the 60s or so, or retirement time. There's a lot of wear and tear. There's a lot of like chip broken down, things that are just worn down, collapsed bites, things like that from grinding. And they're like, all right, it's time to restore everything. So we do full mouth of crowns, veneers, combination, things like that in that side of town. And then Beverly Hills, you got a lot of fun
classic.
stuff. A lot of fun stuff. You got the cosmetic dentistry. You got a lot of implants, of course, as needed.
You keep saying implants, I keep thinking boobs.
Yeah.
Like, you keep saying like we do a lot of implants.
He doesn't
like,
do
does
boobs.
I know, he does teeth. That's boring.
Yes, yeah, exactly. But Beverly Hills, usually their mouths are in better condition. They're healthier for the most part. So it's not as many. It's not like a full mouth of implants, but it's a single tooth, failed root canal, needs an implant. And they're ready to redo the smile.
What top 3 supplements do you recommend people take to get really strong teeth and bones?
That only matters at a really young age when teeth are developing. Obviously, you got your calcium, you got your magnesium, your phosphate. It's just the minerals and nutrients for tooth development. But once you're older, once those teeth are developed, that doesn't matter. It's the external factors like your fluoride, things like that may contribute to strong enamel, or enamel that's more susceptible to be broken down to cavities. So at this point, supplements doesn't really matter. Maybe
about
for
gum
your
health?
for your bones, strong bones.
Yeah.
You have patients that have pre-osteoporosis or any kind of deficiency, and they just have to. It's a jawbone, just like it is your arm bone or any part of your bone. It's calcium supplements, and sometimes you get to take injections for that.
What about gum health? What's the best thing for gum health? Aside from flossing, obviously.
Of course, hygiene.
Yeah.
Hygiene is the best thing for gum health. And now these days, oral health is closely linked to overall health, systemic health. People with chronic gum disease have developed, over years of neglect and poor hygiene are linked to many other diseases in the body. You have also constant toxins in there and bacteria and things that are releasing toxins in your bloodstream. If they're not addressed, you start to get links. We're starting to get links with heart conditions, with other, even autoimmune diseases. So there's a big link between mouth and body.
How can you tell if you have healthy gums?
Bleeding is the first indicator of unhealthy gums inflammation. But if it's at the early stages, it's reversible by good hygiene. The color of the gums, the texture of the gums, if they're bright pink and healthy and they're like sharp edges, they're healthy. If they're bulbous, they're red, they're purple, they're inflamed, it means obviously that it's something deeper going on in there. So, it's the way it looks, the way it feels. They'll tell you that something's wrong. You'll know. You floss and there's profuse bleeding.
That's a problem.
That's a problem. Exactly. Just call your dentist.
Does water picking over flossing, or
Water picking is excellent when you have a lot of prosthetic work in there, like implants, crowns, things like that. It flushes the gums well, but it doesn't replace flossing when it comes to natural teeth, because you got to physically wipe that tooth surface with the floss. And water pick will only flush the gums out. It doesn't really touch that surface. It's a very good supplement, but I wouldn't say
Don't
stop
rely
flossing
just on
and just rely on that. It's a combination.
What about like stem cells or something injected into the gums for receding gum lines?
I wouldn't say stem cells. I think stem cells they need a more controlled environment. Receding gum lines is treated by gum graft surgeries. So you're taking gum from one part to another part, a nice thick healthy gum, and putting in that, and it kind of integrates and kind of restores that recession. But stem cells for gum specifically, we're not there yet, I guess. There's a lot of like medicine now looking at regrowing enamel, regrowing teeth, but it needs a really controlled environment for that to succeed. It does great in a dish in the lab, but in reality, if it's not an isolated environment, you have bacteria, you have contamination, I don't think that's going to work, at least not yet, until it kind of advances.
Just curious.
It advances, yeah. It's progressing. It's very interesting. But we never know what the future holds, you know. Everything AI. Maybe I'm going to be
Well, no, AI, at least,
soon
no, you're
enough.
good with
Yeah,
that.
you can't be
You're good
replaced.
with that. Unless we turn into like the Matrix where you're like eating through a tube or like IVs, you should be fine. The dentistry.
What cases don't you like when people show up?
I went to Mexico, I had my teeth done. Can you fix it?
That's a big one. You know, obviously there's good dentists everywhere, but there's a surplus of poor dentistry done, especially sometimes in the country, especially overseas though, because it is inexpensive, cheap materials, not the greatest training, quick weekend job, you know. That quality work needs time and effort and a good ceramist and a whole team. It's a whole system. And you have to have all the parts working in motion together to really get a great product that's going to last. So when you talk about teeth done in other countries, you go to Mexico, you go to Colombia, you go to Turkey, those are the big three. A lot of that dentistry fails. I had a patient go to Colombia, probably if he hears this, he's going to know who he is. He was flying back from Colombia with his fresh, brand new set of veneers. And he ate a pretzel on the airplane, and guess what happened?
Lost it.
Popped one of them up. Those fresh, brand new veneer. And so, you know, did a little homework, called, found me, and immediately within that first month of getting his veneers, got them swapped out for some good stuff.
So he paid twice.
He paid twice.
Dan, let me ask you a question.
Yeah.
Who does your teeth? Who do you trust with your teeth?
That's a good question.
'Cause you can't be doing it yourself.
I can't. Thankfully, I haven't needed much dental work. I don't have cavities or any issues. I've had one cavity, one filling ever in my life. Mm-hmm. I just do I have a hygienist that cleans my teeth every few months, and once in a while I hit him with whitening. My assistants help me out, do whitening. But
that's it?
Yeah, that's it. I don't really need dental work.
What do you tell your kids though? Like, are they allowed to eat chocolate, candies?
They can. They have a sweet tooth. They love the sugars and all that. And I don't mind it as long as they're on top of their dental hygiene. And I brush the teeth, really. I get in there every night, and I enjoy it. And I show them how to do it, and I do it myself, you know, with them. I floss them. They also ask to be flossed and ask me to help them out. But, you know, I think that's very important. You know, if you have kids, parents really should help the kids brush in those first few years because they skip a lot of surfaces.
My daughter sucks at brushing.
Well, you gotta be,
I do them.
Have you ever done a cone? Do you have the cone exam machine?
Yeah, absolutely. Almost every patient technically should get a cone beam CT scan.
Why?
Because there's so much more information and better diagnosis that we can really pinpoint through a 3D CT scan rather than those 2D close-up images. Infections, cysts, other conditions, impacted teeth. You have sinuses, you have nerves, you have all kinds of structures in there that you need to be aware of.
Do you ever find stuff that's like surprising and got to refer them out to ENT?
Absolutely. I found an interesting case actually. A patient had a wisdom tooth that was impacted up here in the maxillary sinus, up in the sinus, just above her natural tooth right there. I told her about it and I was like, there's a wisdom tooth that's impacted, but it's in the sinus. I'm not going to go after that because there's just a lot of complications that can happen. But I referred her to ENT. She ignored it. Just like, hey, it doesn't bother me, whatever. 5 years later, that tooth has drifted up because the cyst is growing and it's right under her eye socket. It's pushed into the zone of the eye socket area from inside the sinus up there.
That had to hurt to remove.
It's up there, yeah. So I hopefully scared her enough to tell her, you're going to lose your eye if you don't address this. There's a big cyst, there's a tooth under your eyeball, and I don't know if you're feeling pressure yet or not, but
Would you
that's
take
the
that
thing.
out?
I would. That definitely is an ENT type of situation. They go into the sinus up by the eyeball and try to repair things.
What's your
So
thought
it's a challenge.
on root canals? I've heard from doctors that there's no such thing as a clean root canal, and it's better to extract the tooth and do an implant.
I agree with that. Definitely. The more we see root canals, the more failure of root canals. We turn to implants because they're more predictable, more successful. Now, younger patients have an overall good, solid tooth, but a large cavity to the nerve, for example. I'm not against the idea of trying to maintain that tooth for many more years, because root canals, they could last 5, 8, 10 years maybe before they might become problematic again. But at that age, it's not a bad idea to try to save it, preserve it, maintain the space, the tooth, and just the overall health and the bite and the chewing function. That's when I would opt for a root canal. When I see more wear and tear, and the tooth is more broken down and it doesn't look too great, the prognosis is not that. It's like might fail in a few years or so. I opt for implants, always push for implants, because I know it's more predictable, more successful, and it takes out all the bacteria.
But doesn't it take forever to do an implant?
No.
I heard it takes like a year. Like you got to go, come back,
It's
graft, do all this.
Not
Seems like a
necessarily.
hassle.
There are different ways to do it in different situations.
Yeah.
It could be as quick as 2 to 3 months. If they're done immediately, you pull the tooth, you clean, put the implant immediately.
Yeah.
And we do a lot of that, especially in the cosmetic area here, because there's a little more bone to work with.
Does that hurt?
No, honestly, implants are much less painful than extraction
canal?
and root canals, things like that. In general, if work is done well, efficiently, you're not too aggressive,
Yeah.
you shouldn't have pain. You shouldn't have pain in any of those procedures. It should be very minor, post-op, something that could be addressed with Advil or something. Doesn't need anything really strong. And most implants, if they're done well and done quickly and efficiently, a lot of my patients said, I have no pain, I have nothing. I took 1 Advil the night of the procedure. Next day, woke up, I had really absolutely nothing. And it should be that way.
Would you recommend Tylenol?
The Advil has anti-inflammatory effects more than Tylenol, just a painkiller. But usually that's kind of, there's no need for narcotics, Norco and hydrocodone and Percocet, things like that.
All of that makes me nauseous.
You just lost half your customers. Like, oh, doc, I really have a lot of pain. Can I get 30?
But what would you like? Painless dentistry?
Or painful dentistry.
Or popping pills every few hours?
That's funny.
And then you can't poop.
Yeah, that's true.
Yeah, it's all kinds of problems with that.
Cool.
But,
well,
yeah.
how do people find you? Are you on social media?
Social media,
I'm sure.
Dr. Dan Shaer.
On what?
And on Instagram.
You're only on
and-
Instagram?
Yeah.
Okay.
No TikTok?
I have TikTok. I'm not as active on TikTok. I should get back into it. It's fun. But, when you're busy, you only have so many hours in the day.
We'll post his links in the bio.
Yes, and Smile Boutique Group, Smile Boutique Beverly Hills, and the other locations. for
Very
sure.
cool.
Where are you usually found at?
Northridge and Beverly Hills.
Okay.
I'm between those two locations.
You don't hike all the way to
How
Thousand
much money do you carry with you when
do.
you're in Northridge and Beverly Hills? No, I'm kidding. You're trying to find out where your whereabouts are.
No, I'm saying people want to see him.
Yeah, people want to
Yes,
see you.
yes,
How much
yes.
cash you have? How much gold you
Yes.
wear? where they can
Nothing.
catch
none.
you.
Funny guy, huh?
It's LA County. What kind of question
true.
is that? Where
That's
people
true.
catch you?
This guy.
Very cool. Well, thanks for coming on.
Thank you for having me.
Yeah.
Appreciate
It's a
you.
pleasure. Thank you.